Hello, my name is Ramesh. I am the I am an associate professor with the Department of Biochemistry, Cancer Biology, Neuroscience, and Pharmacology. I am also a senior scientist with the National Center for Medical Education, Development, and Research at Meharry Medical College. The responsibilities of this center is to look into the health issues of vulnerable populations, especially people belonging to the gender sexual minorities, people experiencing homelessness, and also people who are migrant farm workers. Specifically, the center is interested in finding out the educational interventions that are currently in place to teach both students and residents about the health issues of these vulnerable populations and to suggest recommendations for incorporating some of the additional approaches that could be done to effectively implement the suggested interventions in primary care settings and clinical practice. One of the tasks that our HRSA-funded center, headed by Dr. Paul Juarez and Patricia Matthews-Juarez, is to conduct interventions to train health professionals on opioid use disorder, to survey the literature, and also to consult with the physicians, academicians, and conduct a systematic review of the literature, develop curriculum modules, and prepare policy briefs for dissemination. As you all know, there has been an enormous increase in the number of opioid-related deaths, almost 13,000 in the year 2018 alone. That tells you the magnitude of the problem in the United States. So to tackle this issue, physicians must be effectively trained to address opioid use among the general population and also the vulnerable populations. We have conducted a systematic review of the literature using PRISMA guidelines to identify original studies that focused on how medical students and residents are taught about opioid use disorder in medical schools. So as part of our systematic review, we have screened 8 databases, which includes PubMed, Meded Portal, CINAHL, PsychInfo, SCOPUS, OVID, ERIC, and Google Scholar. So after a screening of these databases, we have conducted more than 13,000 articles were subjected to extensive search using a set of inclusion and exclusion criteria. The inclusion criteria include studies must be published in English, studies focus on the studies conducted in the US medical schools, and among the exclusion criteria are any publications in conference proceedings, editorials, opinion aids, book chapters, all these were eliminated. So after doing this rigorous search, we came across only 7 studies. One of the reasons for the short number of studies were we employed quality criteria, like we only picked studies that employed one kind or the other of educational interventions, and the studies that involved both the pre-test and the post-test also. And only studies that address these we have picked up. And our studies revealed that there were only 7 studies of all the studies that focused on medical education with respect to opioid training, studies that used a variety of interventions, studies that measured student response before the intervention, and also student response or resident response after the intervention. And unfortunately, there were not many studies done on medical students. The majority of the studies available are on medical residents. And none of the studies focused on opioid use among vulnerable populations. And as of now, there are very few curricula are available in regard to how to effectively diagnose, assess, and treat a patient who may or may not have an opioid use disorder. If they have an opioid use disorder, what are the protocol regimens that they need to follow? How do they treat? How do they diagnose, right? And how to assess a patient's health? What needs to be done for effective follow-ups? So still, there are several gaps in regard to targeting opioid use, not only among vulnerable populations, but also general public. So moving forward, more studies need to be done in this area. Additionally, all the educational institutions, especially the medical schools, and for that matter, other medical allied health professions also, dentistry, nursing, all these should focus on the opioid use disorder. And also, we would like to see to what extent the educational interventions will contribute to success in diagnosing and treating the patients once the students and the residents who have undergone training goes out of the medical school and practice in real-time clinical settings. Thank you.